What I wanted to talk about is cardio-renal-metabolic syndrome. I don't know if that means anything to you, but that's what everybody talks about these days. That's wrong with all of us, or at least a quarter of the adult population. So is GLP-1 the solution? That's what I'm trying to convey to you. So here we have the GLP-1 receptor agonists, and the most important ones of them are semaglutide, that you know as Ozempic and Wegovy, and tirzepatide, as you know as Mounjaro and Zepbound, right? So they're the really important ones. And are they good? Yes, they are. So have a look here at people with diabetes. What you're looking at is the long-term glucose. That's the top bar, and you'll see there are some numbers there, and what it shows is that 50% of people that are treated with tirzepatide will reach a long-term glucose value of less than 5.7%. That is normal, and that's a sensation, really. So another sensation here comes out with the studies of semaglutide, which was looked at here over 2 years in the population of people with diabetes. And what turned out was that they were dying. Fewer of them were dying, and their risk of developing cardiovascular disease was significantly reduced by 26%. So that worked also. And here you can see that the forest plot of all the GLP-1s that are there, they all show very significant effects. So it will also work on heart failure, which was something that was really exciting. And here you can see that both of these two important ones, the tirzepatide and semaglutide, caused a 40% lowering of risk of hospitalization for heart failure, which is really important. And here you're looking at stroke. Stroke is difficult to handle, but nevertheless, there was a reduction here by 30% of the incidence of stroke during treatment. And here you're looking at dementia. So this is 26 controlled trials, and overall in 160,000 people, and 10 of them were with GLP-1 receptor agonists. One was with 12 were with SGLT2 inhibitors. And you can see that overall there wasn't really an effect. But if you look at the GLP-1 receptor agonists, there was a reduction in the risk by 45% of dementia. So here we have a study of semaglutide, and this is the risk of kidney disease. So now we're moving on to the kidney. And this is the FLOW trial, and what I'd like to show you here is that the decreased kidney function, which you see in this graph, is decreased. The impairment is decreased by the semaglutide therapy. So it works also on kidney function in those that need it the most. And dialysis patients here show that you can reduce the mortality of dialysis when you're treated with a GLP-1 agonist. So how does it do this? And there are many ways that we need to think about. One is inflammation. Inflammation is probably the key mechanism here. And this has come out in several papers. I'd like to show this one, which highlights the role of inflammation. It's a recent paper by some experts in that. And another very important thing is the effect on obesity, of course, and we need to talk about that. So here is Wegovy, 18% weight loss over 68 weeks. Here is semaglutide in a cardiovascular outcome trial in 17,600 individuals over 4 years. This is a formidable study. And what happened was that there was a 20% reduction in the risk of cardiovascular complications or deaths in that study. That's a huge and important improvement. So SURMOUNT, that is the tirzepatide study here, 22% or 25% reduction in body weight here, and an extremely important follow-up study here. This study was prolonged by 2 years, 2 additional years, and what you can see is that the risk of developing diabetes, which is so much increased in people with obesity, was eliminated. A 94% reduction in those treated. And here you also see that steatohepatitis is improved very much compared to control studies. And so my conclusion is that these GLP-1 receptor agonists are effective in obesity and diabetes. They improve blood vessels and inhibit inflammation. They have protective effects on the cardiovascular system and offer renal, liver, and neuroprotection. And they can mitigate the cardio-renal-metabolic syndrome. And that was the question I was asking. To me, the most important is that the WHO last week recommended GLP-1 agonists for obesity therapy. And they are now among the essential medicines on their list. So it has really changed. We need to think about these GLP-1 receptor agonists. Thank you.